Hi there, my name is Lacey. I'm going to be your nurse practitioner today, and I was just going to ask you a few questions about you, about your history, and what brings you in. So to start off with, can you please tell me your name?
RM.
Perfect. And what is your primary language?
English.
And how old are you, and when were you born?
59 and a half, and I was born in 1961.
Perfect. Where were you born?
Walnut Creek, California.
And what is your race?
White.
And how about your gender?
Male.
And your marital status?
I'm married.
How about your ethnic or cultural origin?
Irish Armenian.
Perfect. Education, what was the highest level that you completed?
High school.
And what about your occupation?
Construction worker.
What health insurance do you have? Is it like a commercial or state?
It's Kaiser.
And what brings you in today? What would you say your biggest, chief complaint or issue is that you're having?
Well, I've had a little bit of numbness in my right toe, and I am a construction worker, so when I lift heavy objects, the bottom of my foot gets a little numb. So I'm concerned with that. I'm not sure what it is.
Okay. And what do you think brings it on? First off, let's say, how long have you had it for, this right foot numbness?
Probably about 3 years.
Okay. And what do you feel like brings it on? What makes it worse and what makes it better?
I think I'm in construction, so I did a lot of heavy lifting, and I think heavy lifting, at the end of the day, my right foot is pretty numb.
The whole foot, or does it start in the toe and then go to the whole foot?
Well, 3 years ago, it started in the right toe, but now it's my entire right foot.
And do you have any on the left foot?
A tiny bit. It's starting in the left big toe.
Left big toe. And when did it start in the left big toe?
Probably about 1.5 years ago.
So 3 years ago for the right toe, and now it's progressed to the right foot, the full right foot, and then 1.5 years ago for the left big toe.
Yes.
And what do you feel like are your triggers? What makes it worse and what makes it better?
I try to control my sugars, so I don't think I have diabetes, but I think what I do at work is pretty labor intense. And in the morning, I'm okay, but as the day progresses, it gets number and number. So I'm a little concerned with that. I'm not exactly sure what it is.
Okay. So in the morning, it's the best it can be.
Yeah.
At nighttime is the worst. And do you find that are you taking any medication or home remedies or anything like that makes it better?
Well, they gave me gabapentin, and it seems to help just a little bit.
Okay. If you had to rate on a scale from 0 to 10 how much the gabapentin helps you, 0 being none at all and 10 being helps you a lot, it's very effective, how would you grade that?
Well, the one positive, gabapentin does help me sleep at night, and it helps me rest. On a help with numbness in my feet, probably a 2 or a 3 at the most.
Can you tell when you've missed the dose?
Yeah.
Okay.
Yes, I can.
Can you describe the character and location of your symptoms?
My right toe, right foot, and then left foot.
Yes, you said that, sorry. And then does it radiate to any other part of your body, or is it just mainly just on the right and left foot like you were saying?
Just on the right and left foot.
Okay. The severity of it. So on a scale from 0 to 10, would you say that you live at like a 2 or 3 level of effectiveness that the gabapentin gives you? Like, how bad is your pain? Let's start with that on a 0 to 10.
It's not pain, it's just a frustration of numbness.
Okay.
Because I don't see a remedy in sight.
Okay. On a scale from 0 to 10 for numbness and frustration, 10 being you're just at your wit's end, and 0 being that you feel like you can live with this for the rest of your life, how would you rate that?
8.
Okay. How long do you feel like at nighttime? It sounds like the numbness for you is a little bit more intermittent, or is it constant? It's all the time.
It's all the time.
It's constant. Okay.
Yeah.
And the frequency of it, is it every single day? Do you ever feel like if you're in the ocean swimming, that it kind of goes away, or it's just always there?
It's always there.
Okay. So this is obviously affecting your life a great deal.
Yes.
Okay. So past medical history, let's go over that before we delve deeper into your issues. Your medical history. Any major illnesses that you have had during your lifespan, injuries, hospitalizations?
I think the only thing I've really had was asthma, but it's work related due to sawdust, due to the industry I work in, sanding hardwood floors. And I do wear a mask, but I think it has affected my breathing for sure.
Okay. And do you take albuterol for that?
Yes.
As a rescue inhaler, do you take anything every day for maintenance?
I take QVAR, what is it, 100/50.
And then you take your, like the albuterol, the rescue inhaler.
Ventolin, if I need to, like I'll take it on hikes because I exercise a lot.
Okay.
But I don't use it very often, but I always have it with me just in case.
So it's occasional that you use it.
Yes.
Okay. Any major injuries? Your back or?
No, I mean I've broken my leg a couple times and broken my right arm a couple times, but that just was from sports.
Okay.
So.
And no compressions in your discs of your spine or anything like that?
Not that I know of.
Okay. For childhood illnesses, did you ever have measles, mumps, rubella, chickenpox, pertussis, strep throat?
I had the mumps and I did have chickenpox.
Okay. How about surgical history? Have anything significant in your surgical history?
No.
Okay. And then immunizations. Are you all up to date on your vaccines?
Let's go back to surgical because I think I made a mistake. I did have meniscus surgery in my early 30s from my left knee due to work. And they took out 50% of my meniscus on my left knee due to a tear.
In your early 30s?
Yeah.
And the meniscus tear was from work?
Yes.
Okay. Do you feel that causes you issues any time? Pain in your knee? Or...
Once in a while, but it doesn't bother me.
And that's the left, you said?
Yes.
Okay. Immunizations, you're all up to date on your vaccines? I got it.
Yeah.
Okay.
Yeah, sure.
Did you get your COVID vaccine and your flu vaccine this year?
Yes, I thought that was a great idea.
Perfect. Any psychiatric history, depression, anxiety that you've been treated for?
No.
Okay. How about any allergies, medications, food allergies?
I get allergies once in a while. It's kind of funny. Like every 3 years I'll have an allergy season, but nothing to know.
Okay. And then current medications, anything over the counter other than your QVAR, which you take every day, and albuterol occasionally for your asthma history. Any current medications, of course, other than the gabapentin as well?
Hypertension medicine.
And what do you take? Losartan, lisinopril.
Lisinopril.
Okay, lisinopril. Do you know how much you take?
Just 1 pill a day.
Okay. Do you know the dosage?
Oh, I should know that. I do not.
Does it cause you any symptoms that you of note?
No, but I know it helps.
Okay,
Yeah.
good. Anything over the counter? Any vitamins, supplements, herbal remedies?
I'll do a protein shake in the morning, but that's about it.
Okay. And then how about, did you know your dosage of your gabapentin and how often you take it?
I think it's 100 milligrams.
Okay.
And just twice a day. Once about 10 o'clock in the morning, and then once at 5 in the afternoon when I take my hypertension medicine too.
And any side effects that you've noted with that, the gabapentin?
No.
Okay. When was your last examination date for, whether it be your physical, your yearly physical, or dentist? Are you, up to date on your dental visits?
Yes, my dental visits, I do cleaning 3 times a year.
Okay.
And then on medical, I do a blood test once a year. And I just saw my doctor in 2021, February of this year.
Okay. Great. Anything that of note, anything significant that happened in that visit, or was that just kind of reviewing your labs and seeing how you...
Reviewing labs and just a check-in.
Okay, great. Any recent EKGs or chest x-rays?
No.
Okay. Have you ever had chest pain or shortness of breath?
Yeah, due to physical activity, but
Okay.
I'll just pause, catch my breathing, and then I'm okay.
Okay. How about your cholesterol levels? Do you know how those are?
They're normal, actually.
Good. Everything's normal. How about, have you done a colonoscopy before?
Yes, I have. 2 years ago, and I was fine.
Great. 2 years ago.
No polyps.
Great. And then, have you done any like PSA tests, like for your prostate or your analyses recently?
No.
Okay. All right. And then family history. Can you tell me a little bit about your parents? Any family history of note as far as diseases, conditions, cancers?
Yeah, my dad died at 62 years old due to smoking 2 packs of cigarettes a day for years. On my mother's side, my mother's very healthy. She's 86 years old. But her parents both died of cancer. They both smoked heavily.
Okay, heavy smokers. And then how about, do you know about your dad's parents?
My dad's dad died at a normal age.
Okay.
And then his mother too. So health-wise, they were pretty healthy.
Okay. And how about your spouse? Any medical issues as far as that goes?
She did have a hip replacement at 49 years old.
Okay. And what was that for?
Due to arthritis and the hip just wearing out. But she's in good shape right now.
Good.
After the hip replacement.
And how old is she?
She is 53.
53. Perfect. Okay, lifestyle patterns. Spiritual resources or religion. Do you align with a certain religion or spiritual practice?
No.
Okay. And how would you view your health? Is it poor, excellent, good, kind of on a three scale, is it?
I would say, I would probably give it a 7 out of 10.
Okay.
Health-wise. I would give it a higher number rate-wise, but my feet are a little frustrating.
Okay. And nutritional patterns. How is your appetite? Has there been any changes, any current weight gain or weight losses?
No, I don't eat very much in the morning, and at lunch I have a very small lunch, but at nighttime is my only issue with eating.
Okay.
And I do have a sweet tooth, so but I keep an eye on it.
Good. And you were saying that you don't have a history of diabetes, that you know of, that your sugar levels that were tested recently.
Yeah, they're good. Yeah, my sugar levels are good.
Great. How about the amount of fluid that you drink per day, and what type is it? Is it waters, teas?
Usually it's just water. Probably at least on minimum a half gallon a day.
Okay, good. And then any issues with your bowel or bladder patterns? Any incontinence? Any new onset diarrhea, constipation?
No.
Good.
No.
Everything feels normal. No burning, urgency, frequency with urinating?
No.
Good.
No.
Your living environment. Do you live in an urban setting, rural, community, suburban?
Suburban.
Perfect. And type of dwelling. Is it like an apartment, condo?
It's a house.
It's a house.
Single family home.
Great. Do you know any exposures to environmental toxins that you have had other than your workplace?
My workplace, I've had a lot
Okay.
of toxin exposure for sure, but not at home life, none at all.
What kind of toxins would you say, other than the sawdust irritating your lungs, with your asthma history, any other?
I'd say probably a little asbestos
Okay.
and a lot of dust and glue chemicals too that are outlawed and banned now, which is good.
Okay.
And paint thinners. Now they're water-based, thank God, but when I first started, they were oil-based and they were really bad for you.
Mm-hmm. And any issues with your activities of daily living, like brushing your teeth or getting to the supermarket, any barriers to doing those things? It sounds like your feet bother you a lot. Does that keep you from doing your daily activities that you need in order to live?
No.
Okay. Role for family relationships. How do you feel like family decisions are made in your family?
As a team. And my wife and I do compromise.
Good. Good. And do you have a lot of family in the area? Do you have a lot of social support? How would you say that?
Yeah, my wife and I are very lucky to have family very close to us.
Good. That's great. Any issues with your cognitive function as far as memory, speech, judgment, senses, anything that has been different lately?
No, so far so good.
Good. How about your sleep patterns? How many hours a night do you sleep approximately? Do you have trouble sleeping?
Since I recently retired, I've been sleeping a lot better. When I was in the workforce, my average sleep pattern was probably 3 to maybe 5 hours a night.
Okay.
And I know that was unhealthy, and that went on for over 30 years.
Okay. So you feel like you sleep better now. You sleep longer hours. How many hours a night do you say you'd get?
I'd say at least 7 or 8.
Good. Do you know if you snore?
I do not.
No snoring. Good. And do you sleep with just one pillow behind your head?
Yes.
Perfect. Do you take any sleeping aids, anything over the counter, anything?
Actually, I do take trazodone. I wish I would have took it when I was in the workforce. I think it would have helped me maybe calm my mind down and fall asleep.
Good. What, do you take it every night? Do you just take it as needed?
I take it every night.
Every night, good. And do you know the dosage?
No, I wish I did.
That's okay.
I just take one, just one.
Okay.
Yeah.
For the, let's see, every night for the trazodone, anything else other than melatonin, anything else to help you sleep? Okay.
No.
Exercise patterns. How often do you exercise, and what type of exercise is it?
Mine's more hiking and speed walking, and I probably, I would say I exercise on average at least probably 14 to 15 hours a week.
Okay. So is that every day, or is that spread over like 5 days?
That's spread over an entire week.
Okay.
So 7 day.
So you exercise every single day?
Yeah, for sure.
Okay.
Or at least walk every day, or at least every other day. My walks are very long.
Okay. Sounds good. Any issues with your feet when you walk?
Sometimes.
If you overdo it, or...
Yeah.
Okay.
Yeah.
When do you feel like there's issues with your feet? Like at what mile or what time?
I think when I've walked like over 10 miles, then I can feel my feet. Yeah.
And do they recover by the next morning, or are they kind of fired up and very numb?
Yeah, they recover by the next morning, but they're still numb. Like they're very numb. But I know what I do projects at home, like building fences and stuff like that, and they can get really numb. So then I'll shut it down. I'll just pause for a day or two.
Okay.
To calm it down, and then go back to work.
Got it. And that's both feet when they get fired up?
Yeah, both.
The whole foot?
Yeah.
Okay. Where does it stop? Does it stop at like the ankle and down, or?
The ankle, correct.
Okay.
Yeah. The ankle to the toe.
Okay. If I, at your worst, where it's really numb, if I touch your foot, do you think you'd be able to feel it?
I think I can still feel it. It just feels like your feet are in cement. Mm-hmm. It just feels like there's pressure. There's like pressure.
Okay. That must be very frustrating. For your hobbies, leisure activities, it sounds like you like to hike and walk a lot. Anything else that you love to do? Any travel outside of the U.S. or in the U.S.?
I love to travel. I love to be in the ocean. I love Home Depot. Due to projects, I always like to stay busy, and I always have something in the hopper to stay busy. I think keeping your mind busy and your physical body is a good thing.
Yeah, definitely. You say you like to travel and be in the ocean a lot. Any travel outside of the U.S. recently?
No.
Okay. Social habits. Do you smoke or use alcohol or any street drug use, illicit substances?
No, I do not.
What about any intimate partner violence? Do you feel safe in your living environment?
Yes.
Coping and stress management. Any major life changes in the past 2 years? Do you feel tense? What sources of support do you have?
I feel like my life has calmed down due to working a lot of hours for a lot of years. So I think my mind's a lot calmer. My physical body's a lot calmer,
Good.
which is a good thing.
Good. And then sexual patterns. Are you sexually active? Do you have any specific gender preference? And has anything changed about your sexual health or function?
No.
Okay, so the review of systems, this is just yes or no questions, so you can simply say yes or no.
Okay.
So the first system we'll go over just in general. Do you have any new onset or worrisome weakness, fatigue, recent fevers?
No.
As far as skin, any new rashes, lumps, sores, itchiness, dry
No.
skin? Okay. Any change in your hair or nails?
No.
How about any new onset headaches, head injuries, dizziness, vertigo?
No.
Vision changes, eye pain, redness, swelling?
No.
And your last eye exam, do you know when that was?
Yeah, it was 2 months ago, and they said I had 20/20 vision.
Great. Any double vision or blurred vision?
No.
How about any hearing changes, ringing in the ears, earaches, infections, discharge, hearing loss?
No.
Colds, congestion, nasal obstruction, allergies, anything come up of that?
Funny, you say that since the COVID shot and wearing a mask and keeping your hands clean. No colds at all.
Right. Any bleeding gums, mouth pain, toothaches, sore tongues?
No.
Any lumps or enlarged, tender, swollen lymph nodes that you have noticed?
Nope.
Okay. Any, let's see here, lumps, pain, discomfort, nipple discharge from your breasts?
No.
And then any swelling or lumps, tenderness in your axilla, your armpit area?
No.
Any cough, productive or non-productive, that has been occurring recently?
No.
Any wheezing or shortness of breath?
No.
Okay. And do you know when your last TB skin test was?
I do not. Let me think about that. They took some pictures about a year ago because I told them I was concerned about a mole, but they said I was clear.
Okay, great. And then how about any chest pain or discomfort, palpitations?
I have palpitations once in a while.
Okay. Let's see here. You said that you do have a history of hypertension. Any coronary artery disease that you know of that
No.
you've been diagnosed with? Any appetite change, nausea, vomiting, change in bowel habits?
No.
Or food intolerances? Okay. Any frequency, urgency, or pain in your urine?
No.
Okay. Any hesitancy or dribbling when you urinate?
No.
Okay. And let's see. We know about your numbness in your legs. Do you feel like you have any, is it extra colds in your lower legs, or do you have cramps that occur?
Cramps once in a while, but I think that could be from dehydration, even though I do drink a lot of water. But I exercise a lot too, so that could be a correlation.
Okay. Any muscle or joint pains or cramps?
No.
History of arthritis or gout?
No.
Any limitation of movement or history of disc disease in your spine?
Not that I know of.
Okay. Any syncope, so like fainting, seizures, weakness, paralysis?
No.
Okay. Any mood change or history of mental disorders or hallucinations?
Not yet.
Any history of easy bruising, bleeding, blood transfusions?
No.
Any heat or cold intolerance, excessive sweating, excessive thirst?
No.
Okay. Any excessive urination or hunger?
No.
Okay, and then lastly, any memory changes, suicide attempts, or history of mental illness?
No.
Okay, thank you so much. It's been such a pleasure. We will review this and go from there.
All right. Thank you for your
Thank
time.
you.
I appreciate it.